Hey, Dr. Swainey, how long does fentanyl stay in your system?
That's a good question too, and this can be a little bit confusing because when you look at fentanyl on paper, what you see is a very short-acting drug. Fentanyl gets into your system fast, and it gets out of your system fast, and that is very advantageous for a lot of reasons. And you know when you see fentanyl used in the hospital or in outpatient settings and for a legitimate purpose, a lot of times what we see is it's used for procedures, for induction of anesthesia, for conscious sedation, because of that fact, because it gets into your system fast, gives us the effect, meaning that it helps with pain, it helps with, allowing people to be able to have whatever procedures performed, and it's out of the system fast. So your risk of over sedation or prolonged sedation is very minimal when fentanyl is used in this way. So normally fentanyl is very rapid acting, out of your system fast. The problem is fentanyl is lipophilic, meaning that it loves to be stored in fat. And so what we've seen in the community is that as people are using fentanyl, in higher and higher doses and in higher and higher quantities, we get the fentanyl that's stored away in the fat. So when you look at how long fentanyl, breakdown products are in the urine, it's a very long time. And it depends on, again, how much, fentanyl they've been using, how much is stored in the fat. We don't have good equations to, make a determination of, this of just that, how much is stored in the fat. We just know that it is, and we know that it stays around for a long time.